everyone, my name is Karavi.
And my name's Chris.
So we are from PulseCare campaign, and today we are going to be interviewing Dr. Dhuga.
Hi.
So would you like to introduce yourself?
Yeah, as Karavi said, Dr. Gurjeet Dhuga. I'm a dentist, been practicing for over 20 years. Have a private practice here in Vaughan, which is where we are today. Also have a private practice in Brampton. I went to the University of Toronto, graduated from there in 2003.
Wow, that's amazing. Okay, so the first question we have for this interview is, how does the assessment for hypertension done inside a dental office?
So, starting 20 years ago when I first started, we used to have patients come in, we would fill out a medical history with them in person. So the old pen and paper, many years ago we switched to a completely digital office, completely chartless office, where now we send them a link on emails when they sign up as a brand new patient. They either get a text connection or an email connection where they can click on the link, fill out the complete medical history. Part of one of those questions is about high blood pressure, hypertension. Beyond that, obviously, we're asking about medications, dosages, and then when they come in, if they haven't answered the questions correctly, we have one of the front desk or assistants or myself follow up with them in terms of the blood pressure medication they're taking. If they haven't given us the dosage, sometimes they haven't given us the frequency that they're taking them, or sometimes we like to know how long they've been taking them. Is it the same medication? Is it changing? How often are they seeing the family doctor? So all those things are involved in taking an initial medical history to do an initial assessment for the patient.
Okay.
Great, thank you.
Yeah.
So our second question is, how does hypertension affect oral health?
With hypertension, if it's sort of mild hypertension where the patient is not on any medications, the effect on the oral health is minimal. If we have patients who have moderate to severe hypertension where they're into a situation where they're taking hypertensive medications, then yes, we have different effects on the body. Sometimes you'll have interactions with the gingival tissues, sometimes you'll have gingival overgrowth, sometimes you can have interactions between that medication and other medications or medications that I'm providing in the office, such as local anesthetic. You also have interactions where it can cause a situation called dry mouth, and there's many situations where the hypertension affects the type of procedure you're doing, and you have to be careful about a couple of things when you are doing those kinds of procedures for these patients.
So gingival overgrowth affects your gums, right?
Yeah, so the gingival growth meaning the gums, so if the gums can sometimes be aggravated or irritated depending on the medications they're on. Sometimes patients are on multiple medications, so that can cause an interaction and cause an issue, and then it also relates to other things which can exacerbate the issue, things like poor oral health, poor brushing, flossing, those types of things.
Okay. So then how does the hypertension medication impact your oral health?
So if we are on a high blood pressure medication, that means that the blood is obviously circulating and pumping a little bit more quickly in your mouth. So those patients do tend to bleed a little bit more regularly. So with patients who are maybe having a professional cleaning done with one of our hygienists, sometimes the bleeding is a little bit more than the average patient. So sometimes patients will say, oh, hey, I wasn't bleeding like this before. How come I'm bleeding so much? We have to explain to them, if they are on hypertensive medication, if they are seeing their family doctor, maybe you need to go back and have the blood pressure checked again. Maybe they need to change your medications. Maybe there's something going on there that hasn't been diagnosed properly.
Yeah. So you briefly spoke about it, but how does hypertension basically overall affect dental procedures / treatment?
So it affects many different procedures. The main big one that we always worry about is doing any kind of dental surgery, such as extractions, dental implants, periodontal surgery. So anytime you're going to be incising the gingival tissue, anytime you're going to be causing some bleeding in the mouth, you have to be able to control that bleeding. You don't want the patient to have excessive bleeding where you can't see the operative field and can't do what you're doing, whether it's placing a dental implant, doing periodontal surgery, whether you're doing wisdom teeth extractions or even regular extractions. So if patients are at certain blood pressure levels and below, they're safe to treat, and I can manage them in the office with the experience that I have and with the different things we can do in the office. But sometimes if the patients are excessively high in blood pressure, we're talking 180, 190, 200 and above, and I've had patients like that, you have to be really careful.
Yeah, so if you have a patient like that with a really high blood pressure, then how do you prepare for something like dental surgery?
So if we have patients, so it depends on what you define as high. So if we're talking about patients 150, 160, things like that.
Like over 180.
Yeah, so if we're talking about over 180, we have to be very careful. So you're only going to be managing sort of emergency treatment. So I wouldn't be doing a surgical extraction. I wouldn't be taking the patient's tooth out at 180, 190. I had a patient come in at 230 over 110, I remember, and he was insisting I take the tooth out. So if I took the tooth out, I wouldn't be able to stop him from bleeding, and he did not understand it. His face was beet red, his eyes were bulging out. I'm telling him you have high blood pressure. Oh, it's well controlled, it's well controlled. So for those patients, you manage the pain. antibiotic if you need. If there's an abscess or something, you can do a sort of a little bit of an incision or get rid of that drainage to get the pus out of there. But you don't want to go ahead and do a full-fledged surgery at that point. You want to make sure they see their family doctor, try and get their blood pressure under control before you do anything else. So antibiotics, painkillers, Advils, Tylenol 3s to make sure they're well controlled before, and make sure the blood pressure is well controlled before you go in a couple of weeks or a month later to do that surgery that was planned.
So basically what happens if a patient's blood pressure is high during a dental procedure? So is it bleeding, but are there any other side effects?
I mean, it's dangerous if they have other medical conditions. So, I mean, if they have other heart issues, if they have angina, if they have a history of heart attack, if they have any sort of history of stroke, anything like that, you have to be really, really careful. So, in my office for many years, we've always taken a preoperative blood pressure for patients if I'm doing any kind of surgery on the patient. So if we're planning to place an implant, if we're planning to do a wisdom tooth extraction, even a regular extraction, if it's any adult patient, I mean, if it's a 12-year-old, I'm not taking blood pressure, but if we have 18-year-old, 25-year-old, 85-year-old, it's standard. The assistants all know, make sure they take a preoperative blood pressure before I even walk into the room. So if the blood pressure, first thing I do is come in and ask what's the blood pressure. So if they haven't done it, if they forgot, if it's a new assistant, if it's a temp assistant that doesn't really know my policies and procedures, I'll make sure they take it before I get started. So if it is, 150, 160 and below, and I know I can manage it, we'll go ahead with the procedure. If it's above, we'll take a pause, give them a glass of water, relax, recline the chair 45 degrees, watch some TV for a few minutes. All my operatories have windows, kind of watch the nice scenery, come back in 5-10 minutes, try it again. If it's still high on the second reading, then we may have to not do the treatment that day and do the treatment on a different day.
Okay. So then what's like the post-surgery procedure?
If we actually did treatment,
Yeah.
So if we've done wisdom teeth extractions or surgery on a patient, I mean, the first thing is we have to make sure that we're careful with the local anesthetic, which has epinephrine in it, for patients who have hypertension. So you can't give too much epinephrine, which affects the heart and affects the blood pressure as well. So you make sure you limit the amount of epinephrine, which is in the local anesthetic that you give the patient. Post-operatively, we just have to make sure that we're trying to manage the patient as best we can. So making sure that they're taking the blood pressure medications, making sure they're relaxed as we can. Sometimes we do give steroid medication, like dexamethasone medication, to decrease the swelling in the area, which can in turn make sure that they heal a little bit more quickly, and the high blood pressure doesn't cause as much effect on them.
Okay.
Yeah.
So if a patient has hypertension, what would you recommend to keep them out healthy and reduce the risk of oral health complications?
And the first thing is obviously making sure that they're seeing their family doctor on a regular basis. Any patient who is diabetic, any patient who has high cholesterol, any patient who has hypertension or other heart issues should be seeing their family doctor or their cardiologist on a regular basis, maybe every 3 months. They should make sure that they're taking all of their medications on a consistent basis, regular basis. They can check their blood pressure at home. Nowadays you can buy a cuff or go to Shoppers and put your arm in the machine and get your blood pressure taken. So they have to make sure that they're checking things regularly on their own. In terms of oral hygiene, they want to make sure, just like the rest of their body, the mouth is a gateway to your entire mouth. So you want to make sure that the mouth is healthy. How do we do that? Regular things that we all know. Brushing, flossing, coming to see your hygienist regularly, getting your teeth cleaned, getting any problems or issues taken care of, fillings, extractions, surgeries, whatever needs to be done to make sure that the mouth is in ideal condition so it doesn't cause a problem for them long term. Sometimes small things like the mouth or small issues with teeth can cause big problems with their overall systemic health.
Okay, so another question is, what sort of dental emergencies go like hand in hand with high blood pressure? Like what correlates with dental
Yeah, so
emergencies?
sometimes we'll have patients who have high blood pressure who may get into sort of a cardiac issue or a cardiac problem. The opposite, low blood pressure sometimes happens too, where patients can faint in the chair. Syncope, that's the #1 emergency in all dental offices. But the opposite, which we're talking about today, high blood pressure, we have patients who can have an angina attack, sort of an issue with the heart, where they're having some pain, they're having some issues. And the whole feeling of feel like I have an elephant sitting on my stomach, my chest. We have patients who can be having a heart attack, an MI inside in the chair, so myocardial infarction. So you have to know how to distinguish the difference. We have emergency kits in the office. We have oxygen tanks in the office. We have different ways to be able to make sure that we know how to assess the patient properly. All of the ladies here in the office are CPR trained, so we got to make sure we can assess the patient properly. Assess, is it just a hypertensive issue? Patients having a really severe headache. Put the cuff on, check their blood pressure right away. Go ahead and see if it is a different issue. I am having pain in my left arm. I'm possibly having a heart attack. So go through the protocol for that. Call 911. Make sure we have all the proper medications. Give them aspirin if we think it's a heart attack. Those types of things.
Okay. Can you go more in depth about the angina attack, please?
Yeah, so I mean, if a patient comes in, let's say we've taken the full medical history as we talked about at the beginning of the interview, and we know that the patient has absolutely no medical issues other than high blood pressure. So they've never had heart attack, they've never had an issue with their heart, and they don't have a history of angina. So patients who have angina will go ahead and have a nitroglycerin puffer usually with them. At all times we have one here in the office in case of emergency. So a patient will come in and say, I have angina, I have a nitroglycerin puffer, once a week, twice a week I use it. Sometimes if my grandson comes over, I gotta go for a walk with him. He's 4 years old, he's very active. I always take it with me because I know I get kind of winded when I have to run around with him at the park. So if we know it's that type of a patient, we make sure that the nitroglycerin spray is on our tray or on our side cabinet. We know we have easy access to it. So if the patient during the appointment, during the time of placing local anesthetic, or after the appointment feel like, hey, I'm having chest pain, I'm having this pain, I'm having this discomfort, we'll go ahead and give them nitroglycerin spray. We'll wait 5 minutes, did it subside, give it again, give it again. So after 3 sprays, 5 minutes, if it doesn't subside, then we would assume that the patient is now no longer having an angina attack, they're having a myocardial infarction or heart attack. So then we'll go ahead and go through the protocols for that. We'll go ahead and call 911, try and get them some aspirin, get everything under control. Heart attack is a different situation. They have no history of angina. They've never been prescribed nitroglycerin. They're starting to have chest pain sitting in my chair. Right away we would think it's a heart attack. And we'd give them the aspirin, and we'd go ahead and call 911.
Okay.
Those are all the questions we have today.
Yes.
We would like to thank once again Dr.
You're
Dhuga
most
for
welcome. You're
helping
most
us
welcome.
answer these questions and just bringing the awareness of hypertension and how it affects and correlates with dental procedures and everything related to dental.
Most
So
welcome.
thank you so
Most
much once
welcome.
Thank you
again.
so
Most
much.
welcome.
Really
Thank you guys.
appreciate it.
Thank you.
Thank you.